The pledge to create a sustainable and improved NHS is not without its challenges. The Department of Health 5-year forward view aims to transform primary care. We talked to the Minister of State for Community and Social Care, Alistair Burt, about the new priorities.
The Care Act is really landmark stuff. It's the biggest change in social care for a generation, passed in 2014. New rights and opportunities for carers, new responsibilities on local authorities to assess carers' needs. The most important thing, it's about leadership and management. Yes, resource is important. Again, it'd be foolish of me to deny that. But what is overwhelmingly clear is that you can have exactly the same resources in two different places, and one area is handling them genuinely, and here's a value judgment, far better than another. How do we make sure that the practice of the best becomes replicated elsewhere? Clearly, not all areas are the same. You've got huge differences in England in terms of your local authorities in some rural areas and some urban areas. Each can learn from the other. There's good practice in all places, and I'm really looking forward to how Care Act develops. And
what about the cap on care costs? Are there resources in place to be able to deal with that, Alistair?
We've put in place a monitoring service to make sure that we can get as good a standard across the piece as we possibly can. And I'm hearing the same things as I've just mentioned. Some areas that are doing very well, but it will take time for the assessment process to pick up. The assessments are very important. So also is the self-identification of carers, so that people feel that they can come forward and have their needs looked at and assessed.
And how will GPs be expected to play a part in this?
I think GPs' engagement has been terrific. If you look at some of the practices, you'll find that those that have had extended hours, Jim McDonald's practice in Slough, where there's been extended hours working, he's got a 97% satisfaction rate from his patients. If you look at those who are providing more digital opportunities, more telephone opportunities for consultation, they again have similar statistics showing better patient satisfaction, and they themselves are enjoying their job more. If we play our part, if we reduce some of the bureaucracy so that doctors can spend their time doing what they want, if we help with the £1 billion infrastructure transformation fund to give the opportunity for people to have the premises that they're going to need in the future, whether it's smaller for practices or larger, if we encourage the work of federations and say, look, what can you achieve if you're all working together, they can share more things. They can then concentrate on what it is they're best at concentrating at.
Alistair, your father was a GP. How do you think that influences your approach to primary care?
I grew up with that sense of the job as a tremendous vocation, something that my father was very proud to do, something that we all shared in that sense of pride that he had. I'd like doctors to feel that. They have a tremendous reputation with the public, way over and above anything a politician or a minister can ever aspire to.
And what do you think the future looks like, Alistair, in terms of social care and health care? What does that picture look like to you?
Believing that social care is going to remain as it was is, I think, the least likely of all the options. But with all sorts of opportunities to think things through, from different ways of community retirement living to multi-generational households and different things, one solution won't suit everyone, and this isn't a prescription that everybody must follow. But being flexible about how we think about social care, then the interaction with primary care and the NHS, designed to ensure more people are cared for at home rather than using secondary care, this all begins now to create a shape as to where we need to go.